my name is Melody. I create vlogs on my YouTube channel. I'm also an operating room nurse when I'm not creating vlogs on YouTube. And I figured I could talk about what being an OR nurse is really like in hopes that maybe it can help you decide if you want to pursue it or not. I feel like the OR is rarely ever talked about in nursing school. It's one of those specialties that you don't really get to do clinicals in, so you don't get a lot of exposure to it and you don't get tested on it. I also know it's a specialty that a lot of new grads are possibly looking into but just don't have a lot of information on. So if you'd like to know more about my day-to-day life as an OR nurse, how to become an OR nurse, and also should you do it, you should keep watching. So, just a little background, I studied nursing as my undergraduate degree. I became an OR nurse right out of nursing school. It's the only unit that I've worked in. So I don't really have any other experience in nursing other than the OR, so I can't really compare it to like the ICU or med-surg. I've been an OR nurse for about 6 years now. Everything I say in this video is based on my own experience. So I guess this is my little disclaimer. I've only been at 2 facilities and every facility operates differently. They have their own policies. What I experience may not be what you are going to experience, but I'm just gonna throw out general things that happen in the OR or like what I do in the OR. Also, side note, I've never worked in trauma. That is a whole nother beast in itself, and I can't say anything on that. That's totally different. I work at a facility currently that mainly does elective cases and definitely no trauma at all. All right, so number 1, let's talk about how to get into the OR as a new grad or even as an experienced nurse that's working on another unit. So the best way to get into OR is through a Peri-Op 101 program. A lot of times when you're looking at job listings on hospital websites for the OR, especially at teaching facilities, they might say OR nurse residency program or Peri-Op residency program or Peri-Op 101 program. These are made for new graduates or honestly people with zero experience in the OR. It teaches you everything from the basics. Usually it is a 6 to 8 month program. That's how I got into the operating room. I applied to a hospital that was a teaching facility. They had a Peri-Op 101 program. So these programs are usually hybrid. You start in the classroom learning all the basics, like what is counting, what the instruments are, the flow of the OR, the usual drugs that you encounter in the OR, what happens in a code situation, things like that. And as you develop your basic knowledge, you start getting days in the OR, maybe once to twice a week, where you follow a preceptor and you then learn by hands-on experience. Most of these programs teach nurses how to become a circulating nurse, which is usually your primary role in the OR, but some programs offer to teach their nurses how to scrub, which if you're watching like Grey's Anatomy or any medical show, like Hospital Playlists, that's the person who's at the sterile field handing instruments to the surgeon and sometimes assisting in surgery itself. I was fortunate enough to be in a program that taught me both sides, so I was able to circulate and scrub. If you're able to learn to scrub, I would highly recommend it. I think learning how to scrub really puts the whole picture together as how the operation goes. As a circulating nurse and also as a scrub, you're always anticipating what your surgeon needs next. And this is so, 1, they don't have to ask. 2, we don't have to wait for that thing that they're asking for, because let's say you're not anticipating, you're not prepared, and your surgeon's asking for a knife or a scalpel and you don't have it on your field for whatever reason. This is just an example. So the whole room is waiting for your circulating nurse to grab a scalpel to start surgery, which is a waste of time. I think scrubbing allows you to understand the procedures better, thus allowing you to anticipate better as a circulating nurse. These nurse residency programs are usually tailored to new grads, but it's not always the case. I've worked with many nurses who are in the Peri-Op 101 programs who have experience on the floor. Sometimes they have experience in med-surg, sometimes they have experience in the ER. Honestly, these programs are designed for people who just have zero knowledge of the OR. Definitely, as you're graduating from nursing school and if you're interested in the OR, start looking at the hospitals around around you, maybe even look at hospitals not around you, see if they are offering a Peri-Op 101 program. I will also say that these programs are a bit competitive. A lot of times hospitals will only accept 2 to 3 people, sometimes 4 people to be in one cohort. I know the cohort I was in was only 3 people, including me. If you get rejected the first time, don't be discouraged. You can always apply again or transfer. And for nurses who currently work on the floor and are interested in the OR, honestly, talk to your manager. See if you're able to shadow in the OR for a day. See if they can connect you with someone in the OR. A lot of times, a PACU nurse or someone from the floor who's interested in the OR will get paired up with me and just see my day-to-day to see if it's for them. This also kind of puts you on the radar for the OR unit. It makes them know that you're interested. And hopefully, this can help you transition into getting into one of those peri-op programs. All right, next thing, let's talk about what my day-to-day is like in the OR. Let's start very first thing. I wake up usually around 5:30 and I have to get to the hospital by 6:30 in the morning. We're expected to be dressed in our hospital scrubs and to be at morning huddle by like 6:45. During morning huddle is where I look at the board and see where my assignment is for the day. My assignments are made by our charge nurse, who assigns based on what specialty you're really good at, or what surgeons usually work with, or maybe even what shift you work. So there's lots of things that go into assignments. Most ORs that I know of are expected to have your patients in your operating room by 7:30 in the morning. So from morning huddle to 7:30 in the morning, we are basically getting our rooms ready for the patient. This means that we are grabbing medications that is needed for the procedure. We are getting all the positioning equipment for the patient. For example, if you're doing a spine case, your patient is laying prone on their belly. So you got to make sure that you have the correct bed for that. You want to make sure you have correct padding for the patient. And also we want to make sure we have all the equipment we need for the case so we're not running to grab it during the case. We also open for our case, and opening means we are opening our sterile instruments to the field. We are opening everything we need for the procedure to happen. We are also making sure that our anesthesiologist is good to go. A lot of times, if you are expecting a patient that is going to be a difficult intubation, you want to make sure that you have maybe a glide scope nearby or the difficult intubation cart nearby, just to make sure that you're not running during a difficult intubation. And one of the most important things is to count while we're getting our room ready, and this is to make sure that we don't leave anything in the patient. And once the room is ready, I bring the patient back to the OR from pre-op, and this is where I help the anesthesiologist intubate. We put the patient to sleep, and then once the patient is asleep, we position the patient to whatever we need according to the procedure. And then I prep the patient at the surgical site, and then I do a surgical timeout, making sure that we are doing the correct procedure on the correct patient and everyone agrees. And if there's laterality, we make sure we are doing the correct side. During the case, I monitor the case. I make sure that the patient is safe. I'm advocating for the patient because the patient can't talk. They're asleep, right? So I'm advocating for the patient, making sure everything done is on the procedure, making sure that everything we're doing is still sterile, is still safe. And then if we need extra things open onto the sterile field, I will go grab it and open it to the field. Now, once the surgery is done, the anesthesiologist will wake the patient up and we will bring the patient to PACU together. From there, I hand off the patient to the PACU nurse, and then I return to my room. This is where we do something called a turnover, which is when the PCTs come in and any available staff come in. We wipe everything down, we mop the floors, we clean everything. This way we can prepare for our next case. And that whole process of opening for the room starts all over again, and you do this until you finish all your cases for the day. I currently work a 10-hour shift. The shifts in the OR kind of range, but the usual ones are 8-hour shifts where you work Monday to Fridays for 8 hours, or you do 4 days of 10 hours or 3 days of 12 hours. There is also call if you're working the OR, and call is honestly so dependent on your facility that I don't really want to talk about how it works because it's going to be completely different depending on where you work. But just know that being in the OR means that you probably have to take call. So that's kind of the day-to-day of an OR nurse. Now, let's talk about should you do OR nursing? Like I said before, the nursing residency pre-op 101 programs are usually 6 to 8 months long. And this is not a short time commitment. I think a lot of new nurses who start on like med-surg are only given like a 3-month orientation. No, in the OR, it's so specialized that the programs sometimes run even for like more than 8 months. So I just want you guys to know that before committing yourself into it. It's not necessarily a bad thing, it's just a long time commitment. I've seen a lot of new nurses who go through almost the entire program only to realize it's not for them and they end up transferring to another unit, which is fine. It's actually honestly better to know that, this specialty is not for you because it's not for everybody. It's very different than your traditional floor nursing care. So a couple of things I think you should also keep in mind to see if you should do OR nursing is that you definitely want to be a very good team player. In the OR, you're part of a interdisciplinary team, which means that you work with anesthesiologists, surgeons, you work with residents. You want to be able to work in a team setting. You want to be able to work with many different people. In the OR, there's a lot of strong personalities, and you want to make sure that you're able to speak up amongst these strong personalities. And the reason for this is because, like I said before, your patient is asleep and you have to be the person that's advocating for your patient. And if you don't have a strong personality yourself and you're very shy and you're unwilling to speak up, you're essentially, sometimes you could be putting your patient at risk. And that's the reality of it. So if you are adaptable and you know how to navigate strong personalities and you're able to work on a team, then I think the OR is definitely for you. Another very important aspect of the OR is the fact that it's very, very fast paced. If you are not a very fast paced person and you don't like to be rushed, I don't think the OR is for you. When your patient is coming back for surgery, they're usually charged for however much time they spend in the OR. So a lot of times we try to get the patients in and out as fast as we can, obviously with safety in mind. And if an emergency were to arise in the OR, it gets really chaotic and stressful really quickly. So you want to be that person who's able to think on their feet really quickly, prioritize really quickly, even ask for help quickly, things like that. You cannot dilly-dally in the OR. So you definitely want to be a quick on your feet kind of person to be working in the OR. The last thing I want to talk about in regards to should you be an OR nurse is your ability to learn equipment. In the OR, we deal with a lot of different equipment, and this ranges from robotic equipment to cauterizing equipment to lasers to positioning equipment. There are a lot of things in the OR that I did not know is needed for surgery to happen, and all these things I had to learn on the job, and it can definitely become overwhelming really quickly. I don't think that should prevent you from being in the OR. There are definitely a lot of in-services in the OR to make sure that all the staff knows how to operate each equipment correctly and safely, but you kind of have to have that curious mind and that willingness to learn in order to be successful in the OR, because there will always be new equipment coming out. And honestly, sometimes your facility might hire a surgeon who does a procedure that you guys have never done before. So in the OR, you do have to have a learning personality because you'll probably never stop learning in the OR. Like I said, I've been in the OR for like 6 years now, and to this day, I'm still learning new things pretty much every time I'm working. So if you're a curious person, if you like to learn, I think you should consider the OR. All right, guys, and that's a wrap. I hope I was able to explain things clearly for you guys to understand what it's like to be in the OR, and I hope I was able to help you kind of decide if you want to pursue it or not. If you have any questions or if you want me to talk more about this topic, let me know in the comments below. I'll try to get back to you or make a new video in the future talking about more about this operating room life. If you're a new grad who's pursuing to be a nurse in the OR or someone who just started in the OR, I wish you the best of luck. It is definitely overwhelming at first, but just know that everybody who started in the OR started with zero knowledge in the OR. So don't be too hard on yourself if you're not getting it after the first time seeing it. It will take repetition and it will take time. And ultimately, I think being in the OR is very rewarding and I love it. Once again, good luck, and I will see you guys next time. Bye.